Americans are much more active today than ever before, but fitness regimens these days are much different than they were even just 10 years ago. Extreme boot camp style programs and team sports are among the most popular fitness trends today, but they sometimes come with a price. In fact, the number of injuries orthopedic doctors treat is growing just as rapidly as our participation is, and it doesn't matter who you are. From school-age children to weekend warriors, all the way up to professional athletes, millions of Americans are facing serious injuries each year.
Well, there's been a marked increase in orthopedic injuries over the past decade or two, in part because more people are active. That segment of population, 20 to 35, is more active than they used to be, meaning younger people and even older seniors are active where they weren't years ago. We're seeing primarily two types of injuries in the office. The first and most common is what we call overuse injuries. People that come in having pushed their bodies too far, shoulder, knee, low back. The second are traumas, meaning an acute insult where they twist their knee or turn their ankle, they have swelling, pain where they hadn't had it before.
Dr. Kaplan says women are among the fastest growing segment of patients he treats. As more women strive to balance work, family, and fitness, the number is only expected to grow. Stacy is one of these women and explains how she got injured.
I enjoy skiing with my sons. I'm a recreational runner, and I also joined CrossFit. I injured my knee while skiing with my sons in Massachusetts. I heard a pop and felt a pop. I took a very silly, slow fall, and I immediately knew there was a problem. I called Dr. Kaplan. He drained my knee, set me up with an MRI, and told me that I had an ACL tear and a meniscus tear. At that point, he advised me that I needed ACL and meniscus surgery. The recovery was very easy. I went to physical therapy, and I feel like I could do everything now that I did prior to my surgery.
Of course, the goal is to avoid injury altogether. Experts say the best way to do this comes down to a few simple rules. Number one, condition yourself before starting a new or more challenging fitness program by gradually working up to it. 2. Stretching before, during, and after your workout keeps muscles and ligaments limber, significantly decreasing the chance of injury. 3. Avoid becoming overweight. Extra baggage adds increased pressure on our joints. 4. Listen to your body. Acknowledging certain symptoms early on can make a big difference in the progression of an injury.
When you start to get swelling, soreness, stiffness, loss of motion in a knee, ankle, these are signs that you've hurt yourself. It needs to be paid attention to, and if you're not better in a few days with some rest, then you might need to seek medical attention. Of course, if you have an acute injury where you twist something, it becomes very swollen, very painful, then you need to seek immediate care. On occasion, we need to operate, we need to fix things that are wrong, what we call restore the anatomy.
If surgery can't be avoided, the good news is that orthopedic medicine has evolved to a point that not only alleviates pain, but gets patients back to their favorite activities once they've recovered.
I injured myself 4 years ago during a Zumba class, and I was tweaking the knee in certain positions in Zumba, and it was a lot of burning sensation, a lot of uncomfortableness in the knee. So I went to see Dr. Kaplan. He ordered an MRI, which ended up finding a meniscal tear in my knee. The surgery performed was a meniscal repair, and I'm perfectly okay today. I have no problems with this knee whatsoever, and it's like I never even had an issue before. There's no swelling, there's no burning anymore. It's a completely different knee today.
Dr. Kaplan specializes in sports medicine and total joint replacement surgery. Today, he's working on an athlete's injured knee. The outpatient procedure typically takes approximately 20 minutes, and patients make a quick and predictable recovery with decreased pain and increased function.
But we have now an opportunity with better technology, better medicines, better means to work up and then treat injury, rehab being a big part of it. That's one of the great advances we've made in the past 10 to 15 years. But the same tenets that rang true years ago remain the same, namely do no harm. Understand what's wrong with the patient, educate them as to what the options are, and then help guide them into a treatment pattern, usually conservative, on occasion surgery.
When I got into professional baseball, MLB, I was drafted by the Detroit Tigers, eventually played for a few teams like the New York Mets, Philadelphia Phillies, Atlanta Braves, Boston Red Sox. Throughout my career I had numerous injuries that I ended up playing through, knee tearing cartilage in my knee, labrum injuries in my shoulder. You could go on and on and on. And then after my playing days, post-career, Dr. Kaplan had to perform a few surgeries on me as well, on my knee and my shoulder, that were hopefully going to let me kind of go on with a normal life after my playing days. And he's done just that. Dr. Kaplan has really allowed me to live a normal life after a very rigorous playing career, going through all those injuries.
One of the most important things with patient care is to understand who that patient is, how limited they are, what their goals are, and have them get what we call a realistic expectation of what we can do to help them, of what they can do to help themselves. But it's a shared responsibility. They have to take part in their getting better.
From knee to shoulder and all the ligaments in between, the orthopedic health of our bodies is crucial to keeping us in the game. To learn more or schedule a consult with Dr. Kaplan, visit us online or call the number on your screen.